Okay, talking about communicating with the hearing impaired patients. Most have normal intelligence and are not embarrassed by their disability. Just because they can't hear good don't mean they're embarrassed. They don't consider themselves disabled. It don't bother them. But you always want to position yourself so your patient can see your lips. A lot of times when they're hearing impaired, they're very good lip readers. So stand in front of them and, let them see your face and your lips so that they can try to read them if possible. Sometimes they have hearing aids, so, be careful they're not lost during an accident. Sometimes if a patient's confused, they may be forgotten. So, always try to be mindful, and check, with family members and ask family about the use of a hearing aid, check and see if they have them. Because a lot of times if they're used to a hearing aid and you take them to the hospital without one, they feel like they're lost. Some steps to take, when communicating with hearing impaired is, have pen and paper available. And if a patient can read the lips, like I said, face the patient and speak slowly and distinctly, but never shout at them. They may be hard of hearing, but, sometimes they can hear a little bit. But, never shout at the patient, because even sometimes just your body tone of shouting will change the outcome of your communicating with that patient. You want to listen carefully, ask short questions and give short answers. And if at all possible, learn some simple sign language. Useful to know signs for sick, hurt, and help are very useful to know. Ask the patient if he or she can see it all. When we're talking about communicating with the visually impaired patients, visually impaired patients are not necessarily completely blind. They may be able to see a little bit. And expect your patient to have a normal intelligence. Once again, just because they have a disability as far as blindness don't mean that, that they're not a intelligent person. Once again, always explain everything you're doing as you are doing it. With the vision impaired, always stay in physical contact with your patient as you begin your care. And if the patient can walk to the ambulance, place his or her hand on your arm. Let them follow. You be the lead. And transport mobility aids such as a cane with the patient to the hospital. Sometimes, if they have guide dogs, these are easily identified by special harnesses. And if at all possible, transport the dog with the patient. This alleviates stress for both the patient and the dog. Otherwise, if you can't transport the dog, arrange for care of the dog.